alpha blockers, what are they really doing in the body and how they are helping in the blood pressure, benign prostate hypertrophy, or even in case of pheochromocytoma? Let's break it down and make it simple for your Nclex exam. First, what do alpha receptors do? They are part of sympathetic nervous system which controls flight and fight response, and they work via norepinephrine and epinephrine. They're mainly found in blood vessels, smooth muscles, and central nervous system. There are two types of alpha receptors, alpha 1 and alpha 2. Alpha 1 receptor, which mainly found on blood vessels and smooth muscles, their normal function is to cause vasoconstriction and increase the blood pressure. They also help in pupil dilation and tightening of the urinary sphincter. Alpha 2 receptors are mainly found in central nervous system and presynaptic nerve terminal. Normally, they inhibit the norepinephrine release, reduce the blood pressure, and slow down the heart due to the negative feedback mechanism. Let's get back to the alpha blockers. As the name suggests, they block the functioning of alpha receptors, which we just talked about. They are also of two types, selective and non-selective. Selective will only act on alpha 1 receptors, whereas non-selective will act on both alpha 1 and alpha 2 receptors. Selective alpha 1 blockers, they end with the suffix zosin. They work in two ways. So when they block alpha 1 receptors in the blood vessels, that is going to cause vasodilation and reduce the blood pressure. When they block alpha 1 receptor in smooth muscles and act on bladder and the prostate, it relaxes the smooth muscles and help in urination. So they're mainly used for hypertension or benign prostate hypertrophy. Common drugs are PDT, parazosin, doxazosin, and tamsulosin. And the easy way to remember is that P doable because they help with the P and the blood pressure. Side effects. And here's a great tip for your Nclex exam, because first dose of these drugs can cause hypotension and will result in syncope and fainting. So always give the first dose at bedtime. Physician might adjust the first dose comparatively low to the normal dose because of the first dose hypotension. Another important side effect to remember, reflex tachycardia, because of the compensatory mechanism inside the body when baroreceptors kicks in and causes to compensate and increase the heart rate. In order to treat this reflex tachycardia, beta blockers can be used. And due to the vasodilation, other side effects like dizziness, headache, nasal congestion can also result. Nursing consideration number 1, always give the first dose at bedtime. Monitor the blood pressure, especially after giving the first dose, because we expect syncope and fainting. Also monitor for orthostatic hypotension, so slow position changes are required. Next is non-selective alpha blockers, which act in both alpha 1 and alpha 2. So they block alpha 1 receptor, so that is going to cause vasodilation and decrease in blood pressure. And when they act on alpha 2 receptor, it is going to cause increased norepinephrine release, which is going to further contribute to reflex tachycardia. So reflex tachycardia is worse with non-selective alpha blockers, which can be managed with the use of beta blockers. They are mainly used in case of pheochromocytoma, which is an adrenal tumor causes increased secretion of the catecholamines, causing severe hypertension, and also in case of hypertensive crisis, especially due to the catecholamine surge. When non-selective alpha blockers, number 1 is phentolamine, which is also an extravasation antidote for dopamine, mainly used in hypertensive crisis to reverse the epinephrine effect. Because of reflex tachycardia, it can trigger arrhythmias and inguinal pain, so they're contraindicated in the patient with decreased cardiac perfusion. Noxabenzoamine is another alpha blocker, which is mainly used in case of pheochromocytoma. Control the hypertensive crisis arise from the catecholamine release because of the tumor. But since this drug was not very effective for the hypertension in general, so this was discontinued for the hypertension. Now it is mainly used for pheochromocytoma. Side effects, higher risk of hypotension and severe reflex tachycardia. You might want to monitor the blood pressure very closely when your patient is on these drugs. Be prepared to tackle the reflex tachycardia. You may need prescription for beta blocker for your client. I know this was too long, but I hope this video helped. And if you like my video, don't forget to hit like, save, and follow. And I'll see you in my another video.